got a lot of animals, and that's pretty much the only thing that's new in regards to that. I know it's been a while since I made a video, but I wanted to make a video about my hysterectomy because it was a little different due to my giant cyst baby. So I guess first things first, no, I did not know I had a cyst that large for a long time. Yes, I know that sounds like I'm a complete moron, but I had never had a history of cysts in my entire life. It started to grow more when I got into a relationship, and I assumed I was just gaining weight, and being on testosterone makes you gain weight in your stomach more so than like your hips. So I was just like, oh, my stomach's getting bigger, and that was the end of that for me. I liked food and beer too much to try and like get a six-pack, so I didn't really care. Yes, it was causing me pain. I was unable to lay on my stomach. I was unable to do certain exercises. It got so bad that I couldn't tie my own shoes. And that is when I scheduled the appointment. When I first started having pain, I thought I just had a fibroid tumor, because there's a history of that in my family. And I was just waiting to see the doctor and figured that would all just be taken care of with my hysterectomy. I didn't assume there was anything else going on. So, but once it got to the point where I literally had to tie my shoes every day, I called and tried to schedule an appointment. I had to wait a few months to get an appointment, in which everything just kept growing, I'm pretty sure. So I scheduled my appointment at the Eskenazi Hospital in Indianapolis, Indiana, with Dr. Ferries Rowe. She works with a lot of transgender patients and does a lot of hysterectomies for transgender patients. She's very knowledgeable. Jenna went with me to my consult, which was super nerve-wracking. And she was very personable. She made me feel very comfortable. I didn't feel weird about her giving me an exam. So we get there, and at this point, mind you, I still don't know that I have a giant cyst. I just know that my stomach hurts and I'm cramping a lot, and I want my uterus gone more than anything at this point. So I get there, and she does like the manual exam, and everything's fine. And then she goes to push on my stomach before she gets the internal ultrasound, which is the procedure that you usually have to get done, so they can check out everything going on inside. She presses on my stomach, and she noticed it's really tight. She asked me if I was flexing, and I was not. I couldn't really flex at that point anymore. And I told her that's just the way that my stomach has been for the longest time, like longer than I can remember. And she said that was not normal. So I had to get a CT scan done right then and there. Well, by that I mean like an hour later. And right as we're leaving, she calls, and she's talking to Jenna on the phone, and she's like, man, I wish you guys wouldn't have left. You have a huge ovarian cyst. She like couldn't believe how big it was. So the description, when I read online, because they didn't actually post up the CT scan online, said they could measure up to 29 centimeters, but they just couldn't tell how big it really was. So I had my follow-up appointment, and we got to see a picture of the cyst, and it took up my entire stomach. You couldn't see my kidneys, you couldn't see my liver, everything had been pushed around. My poor little bladder was squished to like this big, and she was like, this is why you're in so much pain. You have no room in your stomach, and all of your organs are pushed around. And now, obviously, looking back, it made a lot of sense. I wasn't able to eat as much at once. I got very full very fast. I just never would have imagined that a cyst could get that big before it like burst or something like that, because I know people who have cysts and they get a certain size and then they just burst and it's really painful and then it's over. She said it's likely that I've had it for several years, and for whatever reason, it just decided to rapidly grow within the last year and a half. And yeah. So for people coming on the internet telling me that I'm stupid, I know it seems like that, but one, going to see a gynecologist as a trans man is super uncomfortable. Two, I needed to make sure that I was able to pay my deductible and out-of-pocket maximum for the several $1,000 surgery that I was going to have. So, yeah. So, she calls me and she's like, hey, we should probably do this pretty soon. Like, it's not like super dire, but I would assume you want it out rather quickly. So 2 weeks later, I have my surgery. Because of the cyst, I had to have an open surgery. I couldn't have a laparoscopic surgery like a lot of guys do. Because once they poked the camera in there, all they would see is this giant cyst. So thankfully, she talked to a couple of colleagues, and they decided that they were going to be able to drain it first before they removed it. If they weren't able to drain it, they were going to have to cut me open pretty much from my ribs all the way down to my hips, right down my stomach. so I'd have an even bigger scar. But thankfully, they only cut me from my belly button down. They drained the cyst, they removed it, and they ended up draining 6 liters of fluid. I had a 6-liter cyst in my stomach. It weighed about 15 pounds, roughly. I lost about 20 pounds with surgery, with everything else. And then I've gained some of that back already because I was recovering and just eating whatever I wanted. So that is my hysterectomy. I don't know if I'm gonna be able to get high enough where you can see the scar, but here's the scar that I have. Just goes from my belly button down to my hips. It's still pretty pink, but everything's closed up now. Nothing is really super painful anymore. My recovery was 6 weeks. I spent 3 days in the hospital. The first 2 days I was hooked up to a pain drip, which was amazing because they didn't have me hooked up to it when I first came out, and I was fine for like an hour, and then I was in the most pain that I've ever been in. And I couldn't cry because it hurt my stomach, so I was like, my teeth were chattering, I was trying not to cry, it hurt so bad, and then they finally gave me a pain drip, and it was a godsend. So then after I left the hospital, I came home, I was out of work for 2 weeks, bored out of my mind by the end of the first week, so I messaged my doctor and I was like, can I go back to work? All I do is sit around. Can I just sit around and make money instead of sit around at home by myself? But all in all, my recovery was really smooth. I had my follow-up. She said everything was looking good. I have this little knot in my belly button. That's a little bit, hi baby, a little bit scar tissue and a little bit of a suture. So now I still have a weird belly button because before with the cyst it was weird because it was like starting to push out. But yeah, so all in all, recovery was pretty easy. Coughing and sneezing hurt really bad. Every now and then certain movements will hurt my stomach. I was able to do some ab exercises today that I haven't been able to do in a long time. Yeah, and I think the only question I had was the biggest physical and mental struggle. I'd say probably the biggest physical struggle was the fact that even just walking to the dishwasher and like putting some dishes in there required like a 2-hour nap afterwards. Like I was exhausted all of the time from doing nothing. Jen and I went on a date like a week and a half later and just walked around in like a farm, and I was so tired. We went to Walmart once and I was exhausted. And going to the bathroom was also a very big struggle because it hurt my abs. As far as the biggest mental struggle was just I had to do nothing. Like I could walk a little bit, but that would wear me out, so I couldn't walk very much. But it's just the fact that I could do pretty much nothing. Getting up off the couch hurt sometimes. I had to lay a certain way or it would hurt. I had to try not to cough or sneeze or it would hurt really, really badly. But I don't like to just sit around. Like I can sit around and do nothing for like maybe half a day, and then I get very, very restless. So I was so restless by the end of those 2 weeks. So yeah, I think that was just the biggest struggle. And now it's trying to get my belly back because I did not eat well while I was in recovery, which is fine. But yeah, so here's just a little quick, not quick, this is almost 10 minutes long, snippet of my hysterectomy, my open hysterectomy and giant cyst removal. So yeah, your reproductive health is very important. I know it's super uncomfortable for trans folks, but it is very important to make sure that everything is going the way it should be and you are not growing a giant fluid baby. So that's all I got. And right now I'm gonna show you this little one giving me some love because it does not happen often. Hello. Hello.